Right. Hello, and welcome to our live broadcast. My name is Dora Barilla, and I'm the Group Vice President for Community Health at Providence. And today we're going to be talking about our Housing is Health initiative and really sharing with you about our housing solutions and some of our really important key community partners with Catholic Charities. As a reminder, the information provided during this event is for informational purposes only. If you have any medical questions, please reach out to your primary care or healthcare professional. Now let's begin. Joining me today in this live event will be Carrie Bartel Christensen, our Vice President for Real Estate Strategy and Operations for Providence. Deacon Burkell, the Executive Director of Catholic Charities in Oregon, and Travis Phillips, the Director of Community Development and Housing at Catholic Charities. Thank you all for taking time to talk about this important topic today. I'm going to start with you, Carrie, just to share a little bit with our listeners and our viewers today about yourself and your role within Providence.
Great. Thank you, Dora. As Dora said, my name is Carrie Bartel Christensen, and I'm the Vice President of Real Estate Strategy and Operations for Providence for the Oregon region. And Real Estate Strategy and Operations is the group that oversees the built environment. So we bring together real estate, design, construction, facility engineering, environmental services, biomedical technologies, and a number of other departments, and really support the built environment for Providence, whether it is from long-term strategy planning to executing and making sure work orders get done, or that patient rooms are cleaned and turned so we can put people in them. We really just support the entire operations that happens in our bricks and mortar environment. So I'm pleased to be here talking about this very important topic.
Thank you, Carrie, and Providence is very fortunate to have you. Now let's turn to our community partners. So Travis, if you wouldn't mind just sharing a little bit about yourself and your role within Catholic Charities.
Sure, thanks, Dora. So as we pointed out, I am the Director of Community Development and Housing for Catholic Charities of Oregon. And in that role, essentially, I oversee the operations of over 800 units of affordable rental housing that's within Catholic Charities portfolio across the state of Oregon and over 20 properties. And I also work with our team to look at development of new affordable housing and rental housing to serve the needs of low-income Oregonians, and in particular with Providence right now with a special focus on those who have experienced homelessness and or who have been chronically homeless.
Wonderful. Well, thank you, Travis, for joining us today. And Deacon Burkell, share a bit about yourself and your role within Catholic Charities.
Sure, Dora. Thank you. I'm Rick Burkell. I'm Executive Director of Catholic Charities Oregon. Catholic Charities Oregon is a multi-service agency operating throughout the whole western part of the state, from Portland down to California. We operate a variety of human services and legal services and financial empowerment services and housing. We serve about 20,000 people a year. We try to integrate those services as much as possible so that many of our clients in housing, for example, receive additional services in regard to immigration services or mental health counseling and those sorts of things. So we are particularly interested, of course, in housing as health, and in how to use our stock of housing and our programs to get people into good, healthy housing. That's why we're so excited to be working with everyone at Providence.
Yeah, well, we're really blessed to have you partnering with us as well. We're excited about working on this partnership. So I'm going to start with Carrie. And Carrie, you shared a little bit about how Real Estate Strategy and Operations was working on Housing as the Health initiative, but maybe expand a little on that. And then also share how we're engaging with Catholic Charities.
Yeah, absolutely. Thank you. So as you know, Providence as a ministry has traditionally conducted business. It's been very, focused on the delivery of health care. And when we took a reset of our mission and vision and really started to talk about health being much more broad than just the iterative treatment of disease and really about the whole person care, we also took a step back and started to look at, what is the state of housing and homelessness in the different communities in which we serve? And it might come as no surprise to anybody, but the West Coast, we have a significant amount more homeless individuals than at other places in the country. And as Providence, mostly operates on the West Coast, we felt like as part of our mission, it's our calling not only to make sure that we're delivering health care, but that we're delivering health to the individuals in our ministries. So in 2018 and 2019, we launched what we call our Housing is Health campaign. And we started to look at all the different ministries, the data, the metrics, the recidivism that we see in our ED, and really tried to understand not only where are people homeless, but where are people struggling with housing burden, meaning that the cost to rent a place to live, an affordable, safe place to live, is more than they can reasonably pay with the incomes that they're earning. And then we launched in 2019 and did a large road show with Dora and visited many of our different markets to really talk to the local leaders and say, how is homelessness and housing instability showing up in your market? And it looks very different, like you would imagine. It looks different in Alaska, then it looks in Napa, then it looks in Portland, where we are. And so the strategies to really try to deliver health to these communities have to look a little different depending on where you are. But our Housing is Health campaign is really focused on not only healing chronic homelessness, but also managing the housing instability and creating great, affordable, safe spaces.
Yeah, as you mentioned, Carrie, we have seen in about every community health needs assessment, housing instability and homelessness as being one of the top priorities in each region before COVID-19. Mm-hmm. Can you share a little bit about how COVID-19 pandemic has impacted those that are most vulnerable?
Yeah, really. And I think, Rick and Travis have a great perspective on this as well because of all the work they do directly on the streets. But what we saw is, people that have no home, no place to go, really can't socially distance, right? When you're, living on the street or when you're living in tent communities, it's very hard to keep yourself safe. We saw this not only for our, the people that are homeless, but also for a lot of our senior populations that are very vulnerable. Being able to maintain safe, socially distanced spaces was really critical to people being able to be healthy during this pandemic. And it comes as no surprise that the most poor and the most vulnerable weren't able to maintain those safe spaces. And Rick, you guys really did a lot of work on the street to really help people through COVID. Would you want to talk about that a little bit?
Sure. Carrie, as you say, these are some of the most vulnerable people. The people who we termed chronically homeless, maybe 20% of all the folks who are actually unhoused in Oregon. Are already a very vulnerable population. They're getting older, more disabled. They've been on the streets longer. They have a lifespan of 47 years. If you can imagine, this is a startlingly vulnerable community. Now, what's remarkable to me, and I think to many of us, is that we have not seen high levels of COVID transmission in this community. And I think that the city and the counties have done a great job. Lots of outreach, lots of getting personal protective equipment out to folks on the street, bringing meals to people so that they don't have to travel and congregate a lot has been another strategy. And we've had medical motels, as you all know. When people are infected, we get them out of the general community into motels. We've been providing a lot of the meals for those motels. So there's been, when we look at people in the shelters, same thing. We've only had a small number of people in the shelters who have tested positive, fewer than 20, I believe. And then if you look at just the overall statistics, the number of people, let's say there's 10,000 folks in Multnomah County who have tested positive, fewer than 100 of those have identified themselves as being homeless in the last 12 months. So it's kind of a remarkable, I think some people say we've been very lucky, but the truth of the matter is we have not seen the pandemic affect this community in the way that we had feared. On the other hand, this is a group that already has high rates of tuberculosis, viral hepatitis, AIDS. So this latest viral threat is really just on top of all that. Lots of other infectious diseases are rampant in this community, and we work very carefully. So what do? Well, we do a lot of outreach. When we work very closely with Portland Street Medicine to come out and look at some of our folks. If there's someone we know who's camping who has a fever, or maybe we see some early symptoms, Portland Street Medicine will come out and do the work they can with them. And then the other group, as you say, is the group who are newly unhoused. Yeah. We're worried about the many people who are forced into close relation with their couch surfing. They cannot socially distance, and they've lost housing. 4,400 people just in Southern Oregon in the wildfires, for example, newly unhoused. Where are those folks? Well, they're mostly living with relatives, some in hotels, but again, same precautions, trying to keep folks socially distanced, masked, and lots of hand sanitizer. Those are the best things. Bringing meals to people so they don't have to go out is another strategy. And hopefully these efforts are going to keep the rates of COVID transmission in those various unhoused communities to a lower level as we have now.
Yeah, no, thank you for that. And I know that the projections for some of those, in terms of housing instability and homelessness over the next year, due to the economic impact of COVID, is significant. And so I know you shared a lot about, some of the work that you guys are doing in Catholic Charities, but can you tell us a little bit about the Healthy Housing Initiative overall and what makes it so different?
I'm happy to say a little bit, and Carrie may want to as well, but what I love about the Healthy Housing Initiative, which is our version here in Oregon of how we're bringing together health resources with social services resources. The other partner in that are the parishes. So the idea is that these community resources, and frankly, it started in the Catholic community. So Catholic healthcare, Catholic charities, and Catholic parishes all bring unique resources to the challenge of homelessness and to healthy housing. But if we work together, there is synergy, and we can create an impact that's greater than the sum of anything we could do individually. It really is a way of, I think as well, of thinking about homelessness. Meaning, let's look at the tools we have, the resources we have, and make some decisions about how we can more creatively, more effectively bring those resources together. So it is very much I think, a view that says we have a responsibility and tools to address homelessness, and coming together in this configuration of the Catholic churches, the healthcare system, and the social services really creates unique strength. So very excited to be part of this with Providence, and I think we're making some great things happen.
Yeah, thank you for sharing that. It really is just great to see that strength-based approach from so many partnerships, because we know none of us can do it alone. It really is going to provide that partnership. So Travis, I want to turn, Rick has shared a lot about some of the strategies that we're working on in Oregon. But also, there's the term supportive housing. And I know some people are familiar with it, but really, what does that mean? And why is that such an important part of the strategy in really looking at housing instability and really ending homelessness?
Yeah, you bet, Dora. That's a great question. Thank you. And you set me up beautifully for the answer to it. Because in fact, we all need a little hand sometimes. And that's really the idea of supportive housing. It pairs housing, deeply affordable housing, with case management or supportive services. And for different people who've been homeless for different periods of time, who've become homeless for a variety of different reasons, those supportive services may look very different. In some cases, it may be somebody who can help a person make it to their doctor's appointment, or frankly connect with healthcare in the first place. That's one of our goals of the Healthy Housing Initiative with Providence is to connect folks with primary and behavioral healthcare where they're not already connected. For other people, that's going to be assistance connecting with benefits or employment assistance or other things that just have been, when you don't have a roof over your head, where you don't have a place to plug in your phone, where you don't have a place to receive mail, or prescriptions or anything else, it's really hard to address all of the other challenges in your life, or impossible in most cases. And so if we're able to get folks housed and then provide that support to really help them address the issues, to allow them to be experts in their lives, but then also give them the hand that they need. That's really what housing is. So supportive housing, it's just that housing with voluntary services and support to help them address all of the other challenges that they may have developed once they became homeless, or that were the cause of them becoming homeless in the first place.
Yeah. So Travis, do you feel that, that we were making meaningful progress before COVID? And do you see opportunities for this really disruptive moment in our society to really translate into generative moments, to really, think about having even greater success?
Yes, and yes. I think particularly for those of us in Portland or in any of the larger cities on the West Coast, the reality of homelessness is very visible, even more visible now than it was before COVID. However, despite what you might see, on the streets in downtown, we've actually begun to really chip away at some of our homelessness, some of the chronic homelessness, to really make meaningful strides there. The challenge is that the visual of it doesn't tell the same story, because folks, in fact, are really struggling. So I think the important thing there is to recognize that we have made strides. COVID is and the impacts on folks' income and other parts of their life are going to create new bouts of homelessness for folks. And the faster that we can get them housed, the less trauma, the fewer impacts they're going to see. So that's really important. And the other thing that I know Rick and Carrie are going to be really familiar with, because we've talked about it over the last year or two specifically, is to make sure that we don't become so fatigued in our compassion. And these people who are living on the streets are in fact still people too. And it's important for us to make sure to take care of our community members. And it's important to, this is not a problem that was created overnight. And unfortunately, it's not a problem that's going to be solved overnight. And so we need to make sure that we don't let that compassion fade, and that we continue to double down on our efforts to solve homelessness.
Thank you for that reminder, Travis. So often, it's easy to turn a blind eye, or, the infamous "not in my backyard," but the reality is this is our backyard. Yep. And, we really need to think about this as a collective, and to be sensitive to that, and to be very aware of that. So thank you for that reminder. So Rick, I want to just turn back to you a little bit about, you briefly mentioned COVID, but, how has COVID really altered or accelerated the Healthy Housing Initiative and some of those key partnerships?
I think the COVID has shown a very bright light on the importance of housing in a way that is really transformational. Right, as you say, this is a disruptive time. I think for Catholic Charities, what we believe more and more is that we need to plan for a society in which housing instability is the norm. We think that is part of what communities need to solve for. And that's one reason we like the neighborhood approach. We think that, that locally, that's where we solve for some of the challenges of homelessness that come not just with economic crisis, but fire crisis, COVID crisis, et cetera. So we're increasingly looking at how do we build more flexibility into our housing. I know the hospital system is looking at the same question. We need a continuum that recognizes that people are in various stages of housing instability for a long time. So it isn't just the housed and the unhoused. We need a recognition that there's a lot of instability and a lot of transition that goes on. People go in and out of hospitals and into housing. They go in and out of home care. They go in and out of congregate care. So for us, we're focusing more and more. And one of the projects we're doing with you guys, the Annex, is really all about building flexible housing into the housing system, so that there are not rules that preclude people who need urgent housing from getting in. There aren't rules that say you've made too much money this year, you're not enough money, whatever, you don't have the right password, you can't get housing. Urgent housing is more and more a health intervention, and it's something that we're looking at how to build. The Annex is in fact all about flexible housing, urgent housing for people who need it, and perhaps can't get into affordable housing at the moment. They may be unhoused for 6 months to 18 months. We need to plug those holes as part of our system development.
Housing is a continuum, right? And what we have kind of developed as a society as far as low-income housing fits one part of that continuum. But exactly what Rick is talking about is there's a whole nother upstream where we need to build, availability for people who are newly unhoused or at risk, so that they don't, go into, being homeless for a period of years before they qualify for getting services. And at that point, their health has really degraded. The other place we look at the continuum of housing is really in our hospitals themselves. I think at Providence, Portland, we had a gentleman who was in the hospital for a year. And a hospital is not a place where you should live. And he wasn't there for a year because he needed medical care, but because we didn't have a safe place to discharge him and a place that he could go. And so, housing is so much broader than we tend to think of it in this very narrow context. And as a community, and exactly what Rick is talking about, these local community solutions. That's why parishes are so key to this, because they're really integrated with the neighborhoods. Is how do we really wrap solutions around the individual communities?
Yeah, that's so key, Carrie. And anything else you want to add in terms of how Providence or Providence Supportive Housing is changing the paradigm, post-COVID, of how they're looking at it? To Rick's point, I think it's so key that we're not just, responding to the crisis, that we're all really thinking about a new model of doing housing together as a community. So we'd love to hear your thoughts on that.
Yeah, and Rick is familiar with this because I've talked to him about it before. Providence Supportive Housing, who Tim Zrichny is not here, but he's our fearless leader of. One of the things they are looking at in Eureka is how to blend respite care and recuperative care with permanent supportive housing. And so that you can take somebody who, maybe is in the hospital right now, they may have a medical treatment that's still needed for a couple of weeks. Maybe it's a wound or a course of intravenous antibiotics, but they don't really need to be in the hospital. That's a higher level of care than they need. So how do we partner with the hospitals, with the housing providers, with the community to create safe discharge plans to get people stabilized, move them into recuperative care then, maybe where you're getting signed up for Medicaid, you're getting a case manager assigned, you're getting medications assigned and stabilized, starting behavioral health treatments. And that can last for about 6 months while somebody is getting sort of stabilized and ready to enter permanent supportive housing. So again, as we talk about, the continuum, there's all these different interventions needed. And this is one we're excited about that would combine a few of those. And the project that Rick is talking about, the Annex in Portland, is also one of those really unique areas where we're trying to say, how do we step up and fill the gaps where care is not happening and people are slipping through?
Yeah, I think that's so key. Thank you for sharing that, Carrie. And Travis, one of our viewers has sent in a question. I'm just going to throw it back to you regarding supportive housing. And their question is whether or not there's any requirements or expectations for people, that are in supportive housing in order to, to use the medical, the substance use, or the social services.
Yeah, so the idea of supportive housing really is, in our world, is that there is not a requirement of that. These are voluntary services. And I'll put it in the context a little bit of young children, at least myself as a young child. And if my mom told me what I needed to do, the likelihood that I was going to do that or do it with any kind of putting my heart and soul into it wasn't going to happen. Yeah. And not to say that folks who need supportive housing are young children, but the reality is we tend to work with folks with what's called an assertive engagement model. And that is working very closely with folks, having conversations with them about, kind of, hey, what's going on for you today? What challenges are you having? Oh, you're seeing this? Well, how do you think we might be able to solve that? Or what do you think we might be able to do here?
No.
And allowing them to really be the experts in what that is. And then making sure that we're there with all of the ways in which we can support them, connect them to those services, say, oh, you're having this issue. Well, I saw this thing over here that might be helpful. Does that feel like that would work for you? Again, being assertive with that, it's assertive engagement, right? But also not necessarily requiring it because we found that that's not necessarily successful.
Yeah.
And I'll maybe just underscore that with one last comment that the reality also is that most of the folks who come into our supportive housing are coming in because they're already connected to the support. They just don't have the housing. And the support hasn't been particularly successful when they're not in a stable place. And so, frankly, that support happens very regularly. It's just not the prerequisite to them being able to get into a stable place.
Yeah. No, that's so important. And I think, as we're wrapping up here, sharing some commonalities with successful solutions across some of our communities. What are those commonalities? What is some of the secret sauce in terms of really solving this as a community?
Yeah.
Your Kenton Women's Village,
yeah.
Rick, maybe you could talk about that just a little bit, because I think that was a really successful approach too, and kind of goes to what Travis is talking about people ready and wanting the support service.
Yeah, I mean, we find, that people are highly motivated to get into permanent housing and improve their life. And if they're not, there very well can be some underlying cause for that, some deep depression, some illness, some chronic condition that we have to address first, an addiction. And the truth is, at Kenton, for example, where people are expected to be working on their permanent housing, working on getting a job, working on becoming self-sufficient, people do it when the supports are available. And of course, sometimes we may get to a point with an individual where we say, this isn't necessarily the best fit for you right now. There's a better place where you maybe need to be housed or in a different program. Maybe it's an inpatient. Maybe you need to be inpatient for a while. So it is about finding the right set of supports, I think. When Travis, says supportive housing, he's talking about a wide array, and some of that can just be a peer support who talks with you every day about how you're doing. Maybe we don't call that services, but believe me, it is the engagement beginning that brings someone into a reckoning. How hard are they willing to work? What do they need help with in order to move on? And so we're pretty optimistic. I know Providence is too, about humankind and human nature. We think people are highly motivated to get into services and to take advantage of them when they're offered properly, right? At the right time, in the right dosage, etc. So
I think to add
it
on
is
to
about
that, Rick,
relationships. I think the summary is it's about a relationship with an individual.
that's exactly what I was going to say, Rick. And I think housing and that support, just as with our own doctors and physicians and nurses, when it works well is because you've built trust and you have trust in those folks that you're working with. And I think that's absolutely a common theme and a special sauce there.
Yeah.
I love that. So we're just about at the end of our time of this conversation, but really want to finish with asking, how can people help, or is there anything left unsaid in our conversation today?
One of the things I would say is that when we bring together Catholic Charities and the parishes and Catholic Healthcare, Providence, one of the things we all do have we have lots of volunteers. And I think there'll come a time soon, post-COVID, hopefully post-vaccine, when again volunteers will be more able safely to go out in the community and work in some of these facilities as a volunteer. I do think that's a super valuable connection for any of our residents to have a connection to a volunteer, whether it's a volunteer health provider or volunteer or just someone who's dropping in to do maybe to watch your child for the day. These are valuable contributions that any one of us can make, and I look forward to getting our volunteers back engaged in our housing programs.
I would add to that. The other thing they could do is just get involved in the local politics.
Yeah.
What are your communities looking to pass or to address from a legislative perspective, and make sure your voice is heard. Speak up, email your congressman, your congresswoman, your local planning council. Let them know what matters to you. I think we're very blessed here in Portland that the voters have just passed a few initiatives and approved ballot measures and financial resources that are going to go to address a lot of our homelessness and housing instability. So make sure your voice is heard. Vote for things that matter to us all.
Well, we really want to thank all of you for really joining us in this event, Carrie, Travis, and Rick, and for believing that we can solve this and we can solve this together. So, and to all of our listeners for really being a part of the conversation and listening in today and educating yourself and being a part of the belief that we can solve this together. So I would like to, again, just thank you all for listening and sending in your questions. To learn more about our initiatives, programs, medical services, or ways to give, please visit providence.org and make sure to follow us on social media under Providence on Twitter and at Providence Health System on LinkedIn, Facebook, and Instagram. Thank you and have a blessed day.
Thank you.